This is a 66 years old male presenting with increased cardiac enzymes, mild non-obstructive coronary artery disease by cardiac cath, and a question of acute MI versus myocarditis. So for a CMR, for a thorough and comprehensive approach, let's begin looking at the two-chamber view. In the two-chamber view, we see normal function and regional and global function of the anterior and the inferior wall. So the two-chamber view is normal, no evidence of mitral valve regurgitation. Now the four-chamber view, the main finding is that there is an area of severe hypokinesis in the mid-septum. So there is severe hypokinesis in the mid-septum. The lateral wall demonstrates normal contraction, just mild thickening of the mitral valve, no mitral valve regurg. Then the three-chamber view, we do see that again there is a hypokinesis in the septum. Otherwise, the other walls demonstrate preserved LV function. So this is the initial assessment. So now going through the key assessment, which will be the analysis of short axis and the comparison of cine, tissue-weighted imaging, and delayed enhancement. So beginning with the cine images, we can see preserved function in the apical portion, but again, when I go back to the mid segment, there is this area of regional wall motion abnormality that is not contracting as good as the other walls. When we looked at tissue-weighted imaging, we can see in the same area of the wall motion abnormality there is this transmural area of hyperintensity, which correlates with an area of myocardial edema, and that is in the distribution of the septal branch of the LAD. So large area of myocardial edema, which also correlates with this transmural area of delayed enhancement, demonstrating that there is an acute myocardial infarct in the septal branch in the distribution of the LAD. The four-chamber view also confirms the location of this finding, so it's a focal infarct in the septal distribution. In the mid-septum, there is a sparing of the basal and the apical septum. So this is diagnosis of acute MI with in the distribution of a septal branch from the LAD.